Thank you all. I really appreciate you being here and I appreciate you giving me your time. I'm going to try and be brief on a lot of things, but again, we'll try and address everyone, get everybody's questions answered. We can always schedule a meeting if that's something you wanted to do or you felt like your particular situation needed specific addressing. So today we're going to just talk about what is a SHIP counselor and Medicare basics. I'm going to fly through some of the slides. We'll stick together on this journey. What is a Medicare counselor? Presented by myself. I'm the senior services coordinator at Good Shepherd Hospital, and I'm a certified Medicare counselor, also called a SHIP counselor, Senior Health Insurance Program. And this SHIP mission is just to empower, educate, and assist eligible individuals and their families and caregivers just to understand Medicare more and your health insurance options more. So, just a few quick facts about the SHIP program in general. SHIP is not affiliated with any particular insurance company, so we're not connected to Blue Cross, Aetna, Humana, United Healthcare. We're not connected to any of those. SHIP counselors can help those new to Medicare and currently in Medicare. We explain your health plan choices and benefits and assist with Medicare enrollment. I deal with people once a year during open enrollment. I'm sure you've seen commercials come October 15th through December 7th for annual enrollment. They're always playing commercials for Advantage plans or this plan, this drug plan, that drug plan. This is all just part of my job, reevaluating your insurance on an annual basis. So if that's something you'd like to do, any SHIP counselor can do that with you. SHIP counselors also help with Medicare appeals and enrollment in low-income programs like extra help with Part D drug plans. That's based on income and assets. SHIP Basics. The Illinois SHIP program was created in July 1988 by the Illinois Department of Insurance in response to the needs of Illinois senior citizens regarding their health insurance. So this was 2 years before federal funding had begun. So SHIP was then transferred to Illinois Department on Aging in 2013. Through the Illinois Department on Aging, all SHIP counselors are provided initial training, continuing education, and ongoing support from SHIP counselors, mostly in our state. So the state of Illinois, we meet on a bi-monthly basis and just check in with one another, make sure we understand any fraud that's going on, any major concerns that is happening in the Medicare world. SHIP is a free counseling service. You'll never have to pay for a SHIP counselor. Our responsibility is we cannot recommend a specific insurance company, agency, or policy. 2, we cannot recommend any healthcare network like Northwestern or Advocate. We can't side with anyone. We're a completely objective view on your insurance, your particular situation. We have to attend ongoing education programs and meetings consistently. So we're constantly keeping up to date with what's going on. We talk to community groups about SHIP or information pertinent to senior health insurance issues like we're doing now. I also go to different libraries and present at libraries. I'll be presenting at the Crystal Lake Park District in June, so we kind of bounce around. Um, all SHIP counselors must counsel clients through a SHIP sponsored agency. I work at SHIP, Good Shepherd Hospital, which is a SHIP sponsored agency. You'll also find them at Door Township nearby. Uh, if you live in the Woodstock, Crystal Lake area, um, also Hoffman Estates, Algonquin, anything in that region, in the Good Shepherd Service region, those would be places you would go. Um, and we conduct individual health insurance counseling sessions, and we keep everything completely confidential. I don't go around sharing what Jane or Sherry or Susanna shared with me. And we do agree to a background check. So all of us get fingerprinted regularly, and you're not just dealing with any punk off the street. So let's dive into Medicare. We're just going to kind of brush through some of this. It will be a summary again, but if we have specific questions, we'll try to address a lot of them at the end. If you're in a particular situation where you're not sure what to do, we can talk about that on a one-on-one basis as well. So, Medicare is a federal government program that offers health insurance to those 65 and older or under 65 disabled on Social Security for 24 months, 2 years, uh, any age with end-stage renal disease or ALS, U.S. citizens or permanent legal residents in the U.S. for a minimum of 5 years in a row, including 5 years just before applying for Medicare. Medicare is managed by the Centers of Medicare and Medicaid Services, CMS, and Medicare began in 1965. Meaning it is not quite old enough to apply for Medicare. A brief note, your work history or your spouse's work history can affect your Medicare premiums, but not your eligibility. So if you're divorced, if you're a divorced spouse, you can apply for Medicare benefits on the work record of your former spouse. And they don't have to know about it. You can just use their work history as your eligibility. What's your path to Medicare? Everybody's path is different. There's no one size fits all. Are you going to retire at 65? Do you plan to work past age 65? Are you covered by your spouse's health insurance? Or is your spouse covered by your insurance? It all depends. Everybody's got a different direction that they'll need to go. As a breakdown of what we'll kind of look at individually and what plans you'll hear talked about the most. A and B are distributed by the Social Security Administration. They're the meat and potatoes of all your Medicare. A is for hospital insurance. B is for doctor's visits, blood draws, x-rays, any outpatient services. So A is inpatient, B is outpatient. D is just for drugs, and C is also more commonly referred to as an Advantage plan. So Part C and Advantage plans are synonymous. Okay, so this visual with the animation is a little more uh, expletive with what we're dealing with here. So again, like I said, A and B is what we start with. A and B are the meat and potatoes of all of Medicare. You apply first for A and B through the Social Security Administration. If you want to go down the original Medicare route, which is what we see on our left, we need to add a Part D for just our drugs. And even if you don't take drugs, you should add a Part D, which we can find for a very reasonable price, sometimes even $0. We can find you a Part D that you don't pay anything for on a monthly basis, but you just have in your back pocket in case the doctor prescribes you a antibiotic or something for a rash, a cream for a rash. Then you've got that drug coverage for any drugs that are prescribed. Lastly, we add a Medigap or supplement. Synonymous words. Medigap and supplement. Those two are synonymous as well. That acts as the additional safety net to your A and B. People are drawn to original Medicare because it acts, like I said, as a bigger safety net in the event of a major diagnosis, any kind of accident. You typically do not see a bill from the hospital, and you won't pay copays at the doctor's office. However, you will be paying more monthly. You pay more in monthly premiums in the original Medicare route. So you pay more for the future. You pay more for the what ifs, as opposed to Part C or Advantage, which is more pay as you go. So a Part C Advantage plan will include drug coverage. You'll be able to get your drugs with an Advantage plan. However, if something major happens, you may owe more out of pocket. So pay less now, may owe more later, or pay a lot more now and you owe nothing later. It's kind of that's the balance you need to measure on if you're considering which one you want to go with. Or if you're talking to someone who isn't sure which direction they'd like to go. I call original Medicare the buffet plan because you pick and choose. We have to pick and choose our Part D. We pick and choose our Medigap or supplement. Advantage is more the meal deal route, the number one on the value menu. You get your fries and your drink and your Coke all in one. It's your bundled plan. So I have a graphic on this which I can email out, and if Kristen's able to, she can get it in an email to everybody if you wanted this graphic. So now we're going to kind of delve into more specifics of each of the parts. So for Part A, again, the hospital visits, inpatient visits. Hospital coverage is Part A. So it's the inpatient stays right now, the deductible is $1,736. That's for 2026. Now, that's for day 1 through 60, each benefit period. Meaning, I kind of highlighted at the bottom there, a benefit period begins on your first inpatient day and then ends when you have not received inpatient care for 60 days. So you enter the hospital on October 1st. You leave October 5th. 60 days after October 5th, that's when your new benefit period begins. I hope that makes sense. I know it's kind of clear as mud. $434 is per day, 61 day 61 through 90 for each benefit period. $868 per day, day 91 through 150 of each benefit period. That's with lifetime reserve days. Everybody gets lifetime reserve days included in their Part A. As soon as you sign up, as soon as you're enrolled in Part A. all costs for each day after the lifetime reserve days are are then filtered through your Part A, and then they filter down into either your Medigap or your Advantage. So it kind of trickles down. And then if you have an Advantage plan, you typically get what's left over. You get the out-of-pocket cost. Inpatient mental health care in a psychiatric hospital limited to 190 days in your lifetime. You'll pay $0 for the first 20 days of each benefit period in a skilled nursing facility after a 3-day hospital stay. And then you'll pay $217 per day, day 21 through 100 of each benefit period. All costs for each day after day 100 in each benefit period are then pushed to you. $0 for home health care services, and then 20% of the Medicare approved amount for durable medical equipment that includes walkers, ramps are included, wheelchairs, any durable medical equipment that you use consistently. Part B is our outpatient services. The premium right now, as of 2026, is 202.90 or higher, depending on your income. I'll have a little bit more on that later. Social Security will tell you the exact amount you owe. If you're not currently signed up for Part A and B, you'll get a letter once you do enroll that will specify that amount. The yearly deductible for your Part B is $283. Co-insurance, 20% of co-insurance for most covered services if provider accepts assignment. That's meaning if they take Medicare, accepts assignment they take Medicare. You'd be hard pressed to find anybody who doesn't take Medicare nationwide right now. It's pretty uncommon. You'll pay $0 for some preventative services, and then 20% coinsurance for outpatient mental health services and co-payments for hospital outpatient services. For Part B, you have to have Part B to purchase or join a Medigap or supplement policy in order to purchase a Medicare Advantage plan, or if your employer coverage requires you to have it, meaning you have less than 20 employees at your company. Part B, inactive employment. This is in the situation you are currently employed or your spouse is employed and you're covered under them. If you have coverage through active employment, there's no penalty if you enroll in Part B within 8 months of losing coverage or while you have creditable health coverage, whichever happens first. You may decide to delay Part B if you continue with you or your spouse's employer's creditable health coverage past the age of 65. So if you're working past 65, you still have your employee group health coverage. You can retain that and just apply for Part A and carry on until you're ready to retire or until you're ready to go on to Medicare completely. It all depends on the situation. Again, there's no one size fits all. We just all have different situations. If you do not have coverage from active employment, delaying Part B may mean higher premiums or paying for your health care out of pocket, which you don't want to do. So this is, I had mentioned that the premium was based on your income. This is the income breakdowns for 2026. We can take a look at what you'd be dealing with together if that's something you'd like to do. Typically, they go back 2 years in taxes to evaluate this and base it on whether you filed your taxes jointly or as a single individual. So that's how they base those costs. And it drops as your income goes down. So as you file your taxes, as the years goes on, it drops. Part D, just for prescription drugs. D is just for drugs. So for Part D, Medicare prescription drug coverage is an optional benefit available to everyone with Medicare Part A and B. Again, I had mentioned that if you don't take many meds and you're relatively healthy, you always want to have a Part D, just in case the doctor prescribes you an antibiotic. If they prescribed you something you weren't expecting, all of a sudden you have high blood pressure, you need lisinopril prescribed to you. You have your Part D then to take care of you. Plans offered by Medicare approved private insurance companies, for example, Blue Cross, Aetna, United. You must have Part A and B in order to enroll in Part D, and you choose a plan to meet your needs. Best coverage, lowest costs, convenience, it all depends on your situation. If you're in an Advantage plan, you don't need a separate Part D because the Advantage plan will cover your meds. Um, should I enroll in a Part D? Do you have creditable drug coverage? Is your coverage as good as Medicare's? For example, through an employer plan or the VA. If you're a veteran, usually that's pretty phenomenal coverage, so you wouldn't need a Part D. No penalty if you have creditable drug coverage and delay enrolling in Medicare Part D plan. Will that coverage end when you retire? How much do your current drugs cost? What are the premium costs for Part D plans? Again, we have to base these decisions on your current health situation. What kind of drugs do you take? And we can reevaluate your Part D on an annual basis. We take a look at, say you were in Humana this year, it's not covering one of your meds, or you get prescribed something new that isn't in the plan's formulary. We take a look at other options come annual enrollment. It happens every year. When the commercials ramp up, you make an appointment with a SHIP counselor and you talk to them about your Part D. Without creditable coverage, later enrollment may mean you pay a penalty if a period greater than 2 months lapses. So you don't want to wait. Those penalties, you hear the penalties talked about all the time. They hit with people who delay, who kind of dilly-dally. So don't get too hung up on worrying about penalties. They hit for people who delay things. So Medicare Part D coverage, Medicare sets standards for the types of prescription drugs the Part D plans must cover. All drug plans have a list of tiered drugs that the insurance plan covers, also called formulary. The lower the tier, the lower you pay, the lower your copay. Now, with a drug you're taking that isn't there is a higher tier or is completely not covered by your drug plan, we have ways around that. If you ever talk to a SHIP counselor about a drug that isn't covered by your Part D, or that's a really high tier, we have forms we can have your doctor fill out to get those drugs covered. So we have options in these situations. That's kind of the benefit of dealing with a SHIP counselor. They kind of have these solutions to these problems. So the Inflation Reduction Act, a 1 month supply of each Part D and Medicare Advantage prescription drug covered insulin costs no more than $35 for a 1 month supply. So the Inflation Reduction Act happened a couple years ago, and it's saving for people who are dealing with having to take insulin. It was a really important uh, act of Congress to try and change things, a federal change to things that we really needed. Vaccines are covered under Part D and Medicare Advantage. with prescription drug coverage plans available with no cost sharing, including the shingles vaccine. So the shingles vaccine is covered under your Part D. It originally wasn't covered at all. Other uh, other vaccines or injections you get from a medical professional, from a nurse, from a doctor, that's oftentimes covered under Part B anyway. But the shingles vaccine wasn't at all. Now it is under your Part D. Full extra help is available for Part D enrollees. That's a program that helps us cover our drug costs if they've kind of gotten out of our control and we can't afford our medications. Something we can enroll in together. Uh, it's another program that just helps with people who have mounting drug costs. It's pretty common nowadays. No out-of-pocket drug costs for Part D catastrophic coverage level. So you'll hit different levels. You probably heard of this happening. You hit your donut hole. This is just the amount you need to reach within a year, your maximum out-of-pocket costs before the levels increase, and then you wind up owing nothing. It all depends on the type of drugs you take. Certain people hit that max out-of-pocket really early in the year. Some people don't. It all depends. We're going to talk real quickly about supplemental plans, also known as Medigap. I'm trying to keep a good watch on time here. So supplemental insurance plans, also called Medigap, plans are sold by private insurance companies and are not part of Medicare. So Medicare, remember I said A and B were the meat and potatoes. Everything outside of A and B, Part Ds, Medigap, supplements, Advantage plans, those are all sold by individual insurance companies. Blue Cross, Aetna, Humana, United. Those are all um, insurance companies that are not part of Medicare but are regulated by Medicare. Important distinction. Medigap plans always function secondary to Medicare. They act as your secondary insurance. A and B are primary. Medigap is secondary. Medigap open enrollment period for guaranteed issue is a one-time 6-month window after person first enrolls in Part B. This is only applicable if you're just getting into Medicare, if you're new to Medicare. Medicare supplements may require the prospective policyholder to answer a series of health-related questions to qualify for coverage if purchased outside the guarantee issue period. So if you're going along and you're, say, 72, you had a Blue Cross plan that you bought or that you enrolled in when you first signed up for Medicare, and you decide you don't like this Blue Cross plan. You decide you want to go with Mutual of Omaha. Mutual of Omaha, before they accept you, may ask you a series of health questions. That's what we call medical underwriting. They'll ask you a series of health questions to determine if you're too big a risk. And then they can either decide to not accept you or accept you and charge you more. So it's just important to find a good plan in the beginning if that's the situation you're in, where you're signing up for a supplement. Medicare supplements are all Medigap policies with the same letter offer the same coverage, and we'll look at that in a minute. Regardless of insurance companies selling the policy and provides coverage nationwide. An important note is premiums can vary greatly by company and plan. So the premiums can vary, but the things they cover shouldn't vary. So that meaning all plans under Plan F, whether it's a Blue Cross Plan F, United Healthcare Plan F, they all cover the same things. Plan G, if it's a Blue Cross Plan G, if it's a United Plan G, those are all going to cover the same exact things. Medigap premiums go up with age. Plans cannot be canceled nor charge a higher premium due to health conditions or claims filed once you're in them. If you decide to change, different story. So here's what I was talking about with the different plans. You've got F, you've got G, you got this whole alphabet flying at you. They all cover the same things. Typically, I gear people towards a plan G. They're phasing out Plan C and Plan F. This is not the same Plan A, B, and C as we talked about earlier. A, B, C, and D. It's a different set of letters. Sorry for the confusion there, but that's a completely different set of letters. They're Medigap policy plans. Um, Plan F is phasing out if you turned 65 before 2020, then you'd qualify for a Plan F. If you turned 65 after, you do not qualify. But like I said, I gear people predominantly towards a Plan G because it's the most comprehensive. It's going to cover you the most. It's going to be the biggest safety net in most situations. So here's the birthday rule with Medigap policies. If you have a current Medigap plan and are between the age of 65 and 75 years old, you can switch to an equal or lesser than existing Medigap plan from the same company on your birthday and up to 45 days after your birthday with no medical underwriting. That's the rule here. You have to be in that age range, and it has to switch to an equal or lesser than your existing plan in the same company. So now let's hit Medicare Advantage real quickly. Part C and Advantage are synonymous terms. Medicare Advantage plans, also commonly called Part C or MA, Medicare Advantage or Medicare Advantage with prescription drug coverage. They're a bundled private plan alternative to traditional original Medicare. Medicare pays a fixed amount for your care each month to the Medicare approved private insurance companies. That's where they get their funding. That's why they can charge you $0 because most of them are $0. And they must follow rules set by Medicare. You must be signed up for Parts A and B for Medicare for you to be able to enroll in an Advantage plan, and you must continue to pay your Part B premium monthly. Medicare Advantage plan choices vary depending on your country, your county, sorry, that you primarily reside. So McHenry County, Lake County, Cook County, it'll all be different. Available plans have different rules for how you receive your services. This is kind of a graphic on the increase in Medicare Advantage plans we're seeing in the hospital system, in different hospital systems. And just with Medicare nationwide, we're seeing a big increase in people leaning towards that, mostly because of the cost and how much they save on a monthly basis. What does a Medicare Advantage plan cover? Medicare Advantage plans include all benefits, rights, and protections of Medicare Part A and B. Most Medicare Advantage plans cover prescription drugs. You may have to use network doctors and hospitals. It's going to work the same way as your employee group health plans had worked. You'll have PPOs, HMOs. You're going to see a specific network that you need to stick to with an Advantage plan. And, if you go outside that, you may get charged a little more out of pocket. Medicare Advantage plans are guaranteed issue for all Medicare beneficiaries, so they don't do any medical underwriting. They won't ask you any questions. Medicare Advantage monthly plan premiums do not increase with age. They won't go up as you age. Medicare Advantage plans have star ratings 1 to 5, 5 being the highest. All Medicare Advantage plans have annual maximum out-of-pocket limits for health-related services. Those will typically be higher than you would see with Medigap policy. Here's kind of some of the extras that come with Advantage plans that kind of draws people in. This is the advantage to an Advantage plan. You have your dental, your vision, you have a fitness benefit. You get give back dollars, you get transportation, sometimes meal benefits, meaning home delivered meals, over the counter benefits, meaning you'll get a quarterly little card to spend some money on Band-Aids, Tylenol, whatever you need health-wise. Here's just kind of a comparison, and I can send this graphic as well on comparing Advantage versus supplements. The Medicare enrollment processes. So you should sign up for Part A and B first. That's always the preliminary. You can sign up for your Medicare benefits at age 65, but delay drawing on your Social Security benefits until later. You can delay your Part B and Part D if you or your spouse are currently employed with creditable health insurance. Side note, if you have an HSA, consider contacting a tax advisor for details on when you should stop contributing to your health savings account to avoid tax penalties. Because once you sign up for NB, you cannot contribute anymore and you may get taxed on what's in there. The rule of thumb is 6 months before you sign up for your A and B, you want to stop contributing to an HSA. Medicare enrollment. So you're automatically enrolled if you're collecting Social Security prior to 65 or you're under 65 and disabled. If you do not want to be enrolled in Medicare Part B, you just follow the instructions on the back of the card. There's the card that you receive. You'll see instructions on how to send the form back. And then they just sent you a new card with just your Part A. You are not automatically enrolled. This is nine out of 10 people are not automatically enrolled. If you're not collecting Social Security before age 65, or you're still working and have employer creditable health insurance coverage, if you have medical coverage through a health insurance, through the marketplace. So you can enroll with Social Security, visit a local office, go to ssa.gov, or call to make an appointment. We can also do that with you. Any SHIP counselor can do that with you. That's part of our role. Signing up 3 months before you turn 65, the month you turn 65, and then 3 months after. That's your 7-month window. 3 months before, 1 month that is your birthday, and then 3 months after. So if you enroll in the month of your birthday, then it'll start the month after. So if I turn 65 in October, the Medicare will, and I sign up in October, the Medicare will begin in November. If I sign up in November, it'll begin in December. However, if I sign up in those 3 months prior, if I sign up in September, August, July, then it'll start on my 65th birthday month, October. Hope that made sense. Special enrollment periods. This is if you or your spouse have coverage through work. You can add or make changes to your coverage when certain life events occur, such as losing your creditable health insurance coverage upon retirement or moving out of your planned service area if you change states. So if you move from Illinois to Wisconsin, you would have the opportunity to change. You would be in a special enrollment period. If you have employer creditable group health plan coverage based on you or your spouse's active current employment, you may enroll in Part A and or B anytime while still covered under your employer health plan or within 8 months of loss of coverage or current employment, whichever happens first. Part C or D, enroll within 2 months from loss of coverage. These are just forms that we would need if you delay your Part B coverage. The CMS L564 is given by your employer, that's given by your HR department. That just validates that you had coverage beyond 65. You were covered through your work. So that's showing the federal government that you were covered and there was no lapse in coverage, so that when you fill out CMS 40B, which is your Part B application, you submit those two together so that it kind of acts as your hall pass. So it gets you through the door, make sure that you're covered and everybody knows, you had insurance beyond 65, despite delaying. Your general enrollment period, if you missed your chance to apply for original Medicare benefits during your initial enrollment period and you do not qualify for a special enrollment period, you have another opportunity to sign up for coverage you're entitled to during your general enrollment period, during the general enrollment period. You may be subject to late enrollment penalty fees if you sign up during your general enrollment period. This period is specifically designated for people who kind of delayed or forgot or missed their opportunity for whatever reason. It all depends. So other enrollment periods, you have your annual enrollment period. We kind of talked about that, October 15th through December 7th. That's when we can take a look at either your Part D or your Advantage plan and change you around for the following year. And that happens on an annual basis. You can sit down with a SHIP counselor and just talk about the other options that are out there and what might cover your drugs better, what might offer you better coverage overall. You have your Medicare Advantage open enrollment, which acts in addition to the open enrollment for Advantage plans. So if you're in an Advantage plan, you signed up for a plan during open enrollment, annual and open enrollment, and you didn't wind up not liking it, we can reevaluate it during Medicare Advantage open enrollment, which happens then January 1st to March 31st. So you have these different windows to jump in and out. And then you have your annual notice of change, which comes around September. So if you're in a Humana plan, that's your Part D, they'll send you annual notice of change that's going to tell you, hey, we're not covering your blood pressure meds anymore. We're not covering your metoprolol anymore. They'll notify you of this, and then you have then October to December to change. It's kind of the lead up to open enrollment. In conclusion, I ran through everything really fast, so I was hoping to leave enough time for questions. Medicare is a health insurance program. Plan ahead and keep track of your enrollment periods. The program doesn't cover all your health care costs. You have choices. These are programs available for people with there are programs available for people with limited income and resources. Decisions made affect the type of coverage you get, and certain decisions are time sensitive. Lastly, don't panic. This period or any period within Medicare may feel turbulent, but you have people and resources here to help.
Thanks for the Medicare. For Blue Cross and Blue Shield. For a hip that finally healed. Remember, on prescriptions, generic is a steal. We thank you so much.
And that's it.